morning once again, good afternoon or good evening from wherever you're watching me and what time you're watching me from. My name is Matron Tessy once again, and this is coming to you from Clearview Hospital, where there are some things that I would like to discuss with us, and it's something that is bordering on women's health, particularly pregnancy. It's about pregnancy-induced hypertension. Yes, today we're going to be talking about pregnancy-induced hypertension. So, like I said, we're discussing on pregnancy-induced hypertension, and as the name implies, pregnancy-induced hypertension. So, what is pregnancy-induced hypertension? Basically, pregnancy-induced hypertension is hypertension that a pregnant woman gets from 20 weeks of pregnancy. It occurs from the 20th week, of gestation, and on someone who has never had hypertension before. A normal person, a normal pregnancy, and then all of a sudden hypertension occurs after 20 weeks gestation, and the blood pressure reading is going to be reading from 140/90. The systolic 140, the diastolic 90 at the least, on 2 or more occasions. Then you can clearly say, oh, this person has pregnancy-induced hypertension. And pregnancy-induced hypertension is classified into 3 major groups. You have the gestational hypertension, you have pre-eclampsia, you have eclampsia. Now, one of the major ones we see is the pre-eclampsia. Let me just tell you a bit about the incidence and how serious this matter is. In Nigeria alone, annually we have 37,000 cases of pre-eclampsia. In the southwestern Nigeria, you have about 5.6 to 7.6% of this pre-eclampsia, this disease, pregnancy-induced hypertension. It is so bad. In America, it's the second leading cause of maternal death. And in developing countries or globally, it is the major cause of maternal and perinatal mortality and morbidity. This pregnancy-induced hypertension. It is dangerous to the mother, it is dangerous to the fetus, the unborn fetus. Now, there are characteristics of pregnancy-induced hypertension. One of the 3 major characteristics I'm going to give you. One of the major characteristics is the high blood pressure reading from 140/90. A case where you have is a severe preeclampsia, which is one of the classification of this pregnancy-induced hypertension. You have blood pressure of more than 160 systolic and then 110 diastolic. And then there is even the eclampsia, which is the most severe of it all. And one of the things we try to do is to prevent you from getting to that point. So a main characteristic of pregnancy-induced hypertension or preeclampsia is the high blood pressure, then protein in urine, and then edema, your feet swelling. Some people would have it, some people might not have it. So these are 3 major characteristics in pregnancy-induced hypertension or preeclampsia as we will have it. So what then is the cause of this pregnancy-induced hypertension? The cause is not known. It is idiopathic, but there are predisposing factors to pregnancy-induced hypertension, or what we call risk factors. One is nulliparity or null parity, a situation where a woman who has been pregnant, but her pregnancy has never reached the age of viability. In other words, in Nigeria, the age of viability is 28 weeks. It means that she has not carried pregnancy to 28 weeks. At 28 weeks, we can confidently deliver a baby. They are called preterm or premature. So a person who is having null parity, who has never carried pregnancy to term, is at risk of having pregnancy-induced hypertension. Secondly, multiple gestation, where you have twins, triplets, quadruplets. Someone who has multiple gestation is at risk of having pregnancy-induced hypertension. Then someone who has had history of hypertension is at risk of having pregnancy-induced hypertension. someone with a family history of hypertension is at risk of having pregnancy-induced hypertension. Then an extreme maternal age, where the mother, this lady is less than 20 years or more than 40 years old, is also at risk of having pregnancy-induced hypertension. Gestational diabetes, someone who has gestational diabetes is at risk of having pregnancy-induced hypertension. Fetal malformation, where the growing fetus in the uterus is malformed, can lead to a woman having pregnancy-induced hypertension. Obesity leads to a woman having pregnancy-induced hypertension. So these are some of the risk factors or predisposing factors of pregnancy-induced hypertension in a woman. So what then do we do, or what are the, before I get to what we do, what are the signs and symptoms of pregnancy-induced hypertension? Like we mentioned, 3 major signs and symptoms are the high blood pressure reading of 140/90 and above. Your urine test showing us proteinuria. Then your feet swelling, that may occur. Sometimes there's nausea, there's vomiting, there's right-sided pain, abdominal pain, there's sudden weight gain, and oliguria, urinating in small quantity. These are some of the signs of pregnancy-induced hypertension. So how do we prevent it from worsening? How do we prevent it from becoming eclampsia or severe pre-eclampsia? Major thing or first thing to do is to register for your antenatal early enough. In Nigeria, a lot has gone into trying to manage deaths, occurring from pregnancy-induced hypertension, or cases where we have eclampsia. One of the things the government has done is to build capacity, send qualified staff to rural areas, and then even educate more health workers on identifying the signs and symptoms. So one good thing you will do for yourself is to register early as 12 weeks. Do not wait until you're 20 weeks or until you're 28 weeks before you register for your antenatal classes. That will be detrimental to you, because at that point in time it might be too late to checkmate. Secondly, never undermine any pregnancy. No two pregnancies are the same. Don't say because you've had 2 children before, you've had 4 children before, and then you're pregnant for the 5th one and you just go casually about it. No pregnancy is the same. Every pregnancy is unique in itself. Someone who has never had pregnancy-induced hypertension in the last 3-4 pregnancies might have a PIH in the 5th pregnancy. So never undermine any pregnancy. Register early so that it can be detected early. And when it's detected, of course, your gynae knows what to do. So in this case, what do we do? The management of preeclampsia or pregnancy-induced hypertension will be based on your gynae's jurisdiction or discretion, and certain management plans that are generally known. One of it will be bed rests, either at home or in the hospital. In some cases, you might need to be hospitalized, so that qualified personnel, nurses and midwives will be monitoring your pregnancy, will be monitoring your blood pressure. There might be medications given to you. There will be monitoring of your fetus, where the movement of the fetus will be monitored. We call it, we do what we call CTG in that aspect. The movement of the fetus, the heartbeat of the fetus is going to be monitored regularly while you're hospitalized, so that there will be no complication. Generally, the management plan or the treatment aim is to prevent complication or worsening of the case. So we manage the blood pressure as much as we can. We give you rest, we do all that we need to do as much as we can. And in the end, at the end of the day, delivering the baby, is the goal. And if it gets to the point where the baby needs to be delivered, then the baby would be delivered. And of course, once the baby is delivered, the risk is reduced if properly managed. So I believe with this few information, you will know what to do, in in this whole thing. Basically, like I said, register for your antenatal early enough. And if there are any questions, you can send them, on our YouTube page at Clearview Hospital, where this video is going to be, where you watch, this video, and we would be glad to attend to them. Thank you very much. It's still your girl, Nurse Tessy, the nurse with the sauce.